My name is Dr. Beth Hodges, and I'm the daughter and caregiver for a patient that was cared for by Community Home Care and Hospice. Well, my mother was my best friend, and in her last years she was declining in health and got to a point where she did not want aggressive care anymore. She had gone from a hospital to a nursing home and wanted to come home again, even though she hadn't made much progress in the nursing home. She wanted to be in her apartment in her house and be comfortable. So my husband, who was very supportive and loving, said, absolutely, we'll bring her home, but we need more help. We need to bring in hospice. I promised that I would do that, and but I was fibbing because I emotionally wasn't quite ready for that yet. We brought her home. I did not call hospice like I had promised I would. I made some excuses. But within 24 hours, I knew that had been a mistake. She got into an acute medical problem that needed an emergency help that I could not provide for her. And it was either take her back to the hospital or get some additional help. So I got on the phone and got hospice at 3:30 in the morning, and they came out and they got her comfortable again. And immediately, as soon as the nurse let me back in the room and I saw that Mom was at peace and comfortable and not in pain, I felt much better, and we knew hospice was with us to stay till the end. Well, we have some experience with hospice being in the medical community, and so it was a familiar concept to us. And my husband was very anxious to get hospice in because he knew that between taking care of Mom and trying to work and be with the family, it would be too much for me to do alone. Mom was requiring 24-hour care by then. And we had additional caregivers, but it's one thing to have someone that can sit with your mom and another thing to have a nurse available and all the other aspects of care that hospice provides. So he said it would be fine to bring Mom home, and he was very supportive of that, but he wanted hospice to be involved. And I admit I was a little reluctant at first because I sort of felt that I could do it all on my own and probably still bake cookies for dinner, and that's not the way it needs to be. So we brought them in very, very quickly after Mom got home, and I don't regret it at all. Well, part of it is that I am a physician, and so I felt like I should be able to do all the things that Mom needed. I know all the stages of grief, I know the signs of dying, so I felt like I should be able to handle it all. What could hospice do for me that I didn't already know how to do? But by bringing in hospice, I was able to be Mom's daughter for the last week of her life and not her caregiver, and that's very important. Well, I have to be honest, my husband was under the impression that I had already called them, but I had put it off, and we put Mom to bed that evening and he went on to sleep. As you can imagine, it was a very stressful time because we were also trying to keep life as normal as possible for our children in the house, who only knew a house with Grandma in it and didn't really understand the concept of death. Mom and I were having very open conversations about the fact that she was dying, and so I felt like we had everything under control. Went to bed, and by midnight, I was staying in her room with her. She was in discomfort, and I realized she was in acute urinary retention. That required supplies to take care of that. Although I could do the procedure, I didn't have access to those supplies, and I couldn't help her. So it was either call an ambulance and another trip to the hospital, which she begged me not to do, or I could call hospice. And by 3:30 in the morning, we were both crying, so I called hospice. And the nurse came out and was out there within 30 minutes and shooed me out of the room and got Mom comfortable, and had talked to Mom's doctor and gotten the orders, and everything was just so unbelievably more peaceful when she finished getting Mom comfortable and settled. We knew at that point it was the right decision. My positive experience with hospice has greatly increased my appreciation of the hospice benefit. If you are even thinking that your family member is ready for hospice, call and check it out, because they provide so much more than just a nurse there. It's the full gamut of support from the social workers, the pastoral care, the nurses' aides. It allows you to be your loved one's family member and not just their caregiver, which allows you to have more peace with the process. My positive experience with hospice has really increased my appreciation of the hospice benefit and all that hospice can do. If you have a loved one that is ill and dying, call hospice as soon as you think you're ready and they're ready, because they can provide so much more than just nursing care. The nursing care is phenomenal, but there's social work help to help you deal with some of the financial stressors. There is pastoral care. There's nurses' aides that can help with the day-to-day, just helping keep your loved one comfortable and clean. And it takes a lot of the stress out so that you can be their family member and their loved one and not just their caregiver. The hardest part is making that initial phone call, because on some level you're admitting that you're going to lose your loved one. But once you get through that phone call, it will be a very positive experience for you. And I encourage anybody in that situation to make the call. For that week that my mom lived on hospice, I was her daughter. I was not her caregiver. I was not her doctor. I was just her daughter that loved her. And I didn't have to think about medical things or anything other than just loving her and being there with her. Well, as a physician, I'd had some interactions with other hospices, and I think in general hospice is a wonderful thing, but I wasn't completely pleased with the interactions I'd had. And community was just coming into the area, so it was a fresh start with a new hospice provider, and I thought that interested me. So I applied for the position, and I have never looked back. It has broadened my medical experience, not just with dealing more with death and dying, but also I think it's made me a better physician for all of my patients, and more understanding of some of my patients who have family members who are dying. Not just my elderly patients, but perhaps I have a 40-year-old woman who's dealing with her mom, who's in the process of passing away. Hospice is a very spiritual aspect of care for me, and it enriches my experience of the practice of medicine. Well, there are certain mandated benefits that all hospices provide, and that's determined by Medicare and Medicaid. But each individual company has their own personality and their own set of staff and rules. And I've had positive experiences with hospice corporations and negative experiences with them. I think they're all good to a certain extent because of what they do, but I'm a huge fan of community home care and hospice because I feel like we really care for the patients and we really put our best into it. They always come first, and they also support the community in general.
Perfect.
As the medical director, I'm kind of the go-to person. So each person enrolled in hospice can have their own physician if that physician is able to and willing to serve as their hospice doctor. If that doctor can't be reached and no one covering for that doctor can be reached, then, and the nurses need something urgently, then they're going to call me. Or alternatively, if for example, you have a cardiologist. Cardiologist doesn't feel comfortable managing your hospice stay, then they can ask me to take over as the attending, and I'm happy to do that. Some specialists don't feel comfortable managing the full gamut of hospice responsibilities. Or he can be involved and ask me just to do certain aspects of the care. I'm available 24/7. My nurses can reach me and ask me questions. I can talk to an attending physician who has a question about something or to a family member. And by doing that, we just make sure there's 24/7 physician care of each patient. That's up to the patient and the attending. If an attending is willing to serve as the patient's hospice physician, then that is what occurs. If for some reason the patient's family wants to go with the hospice medical director, that is an option. But we do encourage them to stay with their attending because he or she probably knows the patient and the family better. But I'm always available 24/7 for additional coverage or questions, or if there's an emergency where the doctor can't be reached and they need something urgently. Before becoming a medical director, I did not have a full appreciation for hospice or understanding even of who was appropriate for hospice admission. You don't think about patients with advanced dementia or a neurologic condition or just failure to thrive as being really hospice appropriate. You think about it more with cancer issues. So there were probably a lot of patients that would have benefited from hospice that I didn't think to refer to hospice. In terms of being a hospice medical director and how that affects how I approach end-of-life conversations, I know I'm a lot more comfortable with end-of-life conversations with patients and their families. It's hard for a doctor to do that with a patient, sometimes because you're afraid the patient or the family will think you've given up on them, and sometimes just because you're rushed, you don't know if you really want to get into that conversation at the end of an office visit. When should you get into that conversation? Our schedules are so tight, it's hard to make that decision to move forward at times. But having the hospice experience, I feel like I have a better handle on when to cross that and when to approach that discussion. And I feel very comfortable, and I can tell my patients and their families that, look, I have been through this, I have had hospice, and I know exactly what you're going through. I know what you're feeling, and I can help you through this. It is a difficult discussion to initiate because on the one hand, you want to do what's right for your patient. On the other hand, you don't want them to get the impression you're giving up on them or to give that impression to their families, because that can be very disheartening and frightening. It also takes time to have that conversation. In our rushed lives and rushed schedules, it can be hard to open that door knowing that you might be opening the door to a very lengthy and difficult conversation. So it's much easier just to kind of skim by it and wait for the next time, but then that can happen again. I feel physicians avoid end-of-life conversations with their patients and families because they do not want families or patients to feel that they're giving up on them. My mom was a total prankster. She loved to play jokes on people, and she loved life, and she loved her life in our house with our family. And when she got ill and couldn't really enjoy that life as she had been, she set her own terms on how it needed to be. I spent the last few years of her life telling her how to take her medicine and how to take care of herself and what to do. And in the end, she told me what to do, which was back off and keep me comfortable and take me home. And that's what we did. Oh, Mom was very close to my kids. They never knew a house without Grandma in it. And she baked them bread every day that she was healthy enough. And they would go downstairs to her apartment and have Grandma bread. And so since she has passed away, I have to make Grandma bread at least a couple times a week.